indicators that a patient's disease may have relapsed?
Yeah, so we would typically be following a patient about every 3 months, somebody that's gone through the initial induction, consolidation, maybe they're on maintenance therapy, or maybe they're on active therapy for after they've relapsed from the myeloma. Each of those visits every 3 months, we're monitoring blood work, we're monitoring the monoclonal protein that the myeloma produces, or if it doesn't produce much of that protein, we're monitoring other parameters, say urine testing, or maybe even imaging like a PET scan. And we're looking for consistent rises in that number. And we're looking for not necessarily a little rise in the protein, but incremental continuous rise. That suggests that the myeloma is starting to grow again, and it's growing on the current treatment, and we need to switch gears and try a different treatment. There are some patients who that protein, the myeloma cancer doesn't die to treatments. That's refractory. So we try a treatment and there's just no response. We don't see a drop in the protein in the blood. We still see a good burden of the myeloma in the bone marrow biopsy. In those patients, then that's also an indication to try a different treatment.
Mm-hmm. You mentioned that myeloma often returns. So how typical is it for a patient to relapse?
Yeah, I would say that's the norm for patients with myeloma. There are reports in patients who undergo things like stem cell transplant that maybe 10% of patients might be out 10 years without detection of their myeloma. But that's not the norm. So most patients who are diagnosed with myeloma will go through periods of treatment and hopefully periods of remission. The majority go into periods of remission in the myeloma where it's not very active, but the myeloma tends to come back.
If a person is relapsed or refractory, how are they typically treated?
So when they relapse, it depends on their prior treatment. So if the myeloma is not responding to a drug, then it's from the physician's perspective that's treating you, a good idea to change the type of chemotherapy drug that you're on. Anytime, whether it's diagnosis or relapse, clinical trials are appropriate to engage with and potentially even use as primary treatment. All clinical studies in myeloma or for cancers in general are typically engineered around active treatments for the cancer. And so those studies in myeloma, when you're having the cancer relapse, say early in the course of your cancer, those studies typically are geared to use drugs that are approved by the FDA later in the lines of treatment. Maybe you've had to progress after 4 lines of treatment, but trying to move them earlier. And they're very active in the 4th line. So you could potentially have access to an active treatment moved earlier in the treatment through a clinical trial. There's also a long list of other approved myeloma therapies. There's a good handout, I think, through the NCCN for patients for myeloma that lists a lot of the approved myeloma therapies and kind of guides patients. It's a good resource book that I would point any of the listeners to.